This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning. Welcome into the program, Mon Health Talk. Dave Wilson. Sarah's off for the week, and I've got two guests with us this morning, Dr. William Post, Mountaineer Orthopedic Specialist, and Stacy Ferguson, Mon Health Outpatient Surgery Center. Good morning, guys.
Good morning,
Dave.
Well, thanks for taking a few minutes with us here on Monday morning, and as customary, I'm going to make you talk about yourself here for just a couple of minutes before we dive into our subject today. Let's see, eeny, meeny, miny, mo. Dr. Post, we'll start with you. Just tell me about yourself, where you're from, and how you ended up with Mountaineer Orthopedics.
Well, Dave, I'm born and raised in eastern Pennsylvania, but I've been in West Virginia since about 1986, so this is home now. I practiced at WVU starting in 1991 after residency for about 9 years, and then I've been at Mountaineer Orthopedics in solo practice for the last almost 20 years now, and at Mon Health for that last 20 years. So my practice is sports medicine and shoulder surgery. We do a lot of knee and shoulder surgery. The majority of it is outpatient surgery at the ambulatory surgery center that we're talking about today.
Don't mean to make a generalization here, but most of the guys who are in orthopedics who do sports-related specialties and joint replacements, they're old athletes themselves. So is that the case with you?
Who are you calling old, Dave?
Maybe former athlete. Is that a better term there?
They're both good and they're both accurate, I think, in this case. So, but yeah, I did grow up as a child playing every sport coming and going through college, and I had my share of injuries. And yes, that is how I got interested in orthopedic sports medicine, and that I was very fortunate to have the idea that I wanted to do that early when I was a teenager, and it worked out that way, and I still love what I do. Yeah. So you nailed it on the head, actually.
It just seems to be a common story. You know, guys get injured, and during the rehab process and the healing process, they go, oh, wait, I could make a career out of doing this too, helping athletes. Just seems to be common. And, yeah, I spent time with an orthopedist years ago for an injury as well. So, but clearly, I went a different direction. Stacy,
it is interesting too to say, if they don't mind interrupting there,
sure.
But I see that happen all the time too with my patients too. They get involved with their injuries and they learn about what we're doing in various parts of the professions that care for them, and it's fun to see them sometimes have a career and a life change as a result of an injury.
And Stacy, a little bit about your background.
I'm an RN. An older RN. I graduated nursing school in 91. I'm from Martinsburg, West Virginia. I worked in a hospital for several years and had an opportunity to develop and manage a surgical center down in that area. I worked there for about 14 years, and I got a call from HVP, which is a development and management company for ASCs, to come look at Morgantown area. So I met up with these guys, met the doctors, Dr. Post and MOA team, and Dr. McClellan, several of the other physician owners, and met with the board, and they offered me a position up here. So I've been here since before we had bricks. And now we're built, we're running well, and I'm managing the place for them.
Well, guys, we're going to get into same-day joint replacement here in just a minute. But before we do that, Dr. Post, earlier, I guess it was last week, early in the week, Governor Justice talked about elective surgeries. The 900-pound gorilla in the room, obviously, is COVID-19 and hospital availability and making sure we have enough beds to deal with that. So as far as same-day joint replacement goes and orthopedic surgeries, are those impacted with the governor wanting to, postpone elective surgeries that may not be critical right now?
Well, Dave, of course, we do have to put the health of our community first and respect the governor's guidelines and mandates. And they've been directed recently at managing hospital inpatient capacity by case selection, by selecting the cases that are urgent or emergent. But in our ambulatory surgery center, of course, the patients go home after surgery. So that doesn't really affect the inpatient bed capacity in care of potential or current COVID patients. So for right now, we're full speed ahead, but we're standing by to do whatever we can for the good of the community.
We're going to talk about same-day joint replacement. As the doc said, going home after your surgery. Sounds like a good idea. We'll get the details. We'll let him explain all about that coming up. You're listening to Mon Health Talk right here on the Voice of Morgantown, WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, call now at 304-296-0041.
Talking to Dr. William Post, Mountaineer Orthopedic Specialist, Stacy Ferguson, Mon Health Outpatient Surgery Center this morning. Going to focus in on same-day joint replacement here. And Dr. Post, how does an outpatient total joint procedure compare to the traditional joint replacement?
Well, Dave, the actual surgical procedure is identical. The true differences come in the extensive preoperative preparation and teaching of the patient and the family, the actual methods of anesthesia and pain control, which have made terrific advances in the last years, and then the arrangements for very close home therapy, physical therapy, and medical follow-up support when they go home. So the actual procedure and the actual long-term benefits have been proven to be as effective as traditional inpatient surgery. But the benefits, of course, are the comfort of being at home, and the patient experience is uniformly better. Patients are enthusiastically more pleased with the outpatient surgery when they've had both.
Well, what makes the outpatient surgery possible? Is it just better techniques these days, advancements? What has allowed that to, make this I hate to call it an in-and-out procedure, but you go in, you get it done, you're back home later that night, and you're not in the hospital for 3 or 4 days.
Exactly. And I think the biggest improvements really have been with the anesthesia in that regard, allowing them to have different methods of regional anesthesia, in other words, nerve blocks where they have the pain blocked before the pain actually starts at surgery, and then they wake up pain-free and they're able to avoid the narcotic pain medications most times that can have side effects and so forth. So it's the anesthesia changes that are, I think, the key to being able to do more invasive major surgeries and let people go home the same day. But I do have to emphasize, too, that outpatient surgery is not for everybody in terms of joint replacement. It has to be the right patient, the patient that is relatively healthy, that has good supportive family, and has a desire to do the procedure as an outpatient.
So is that a conversation you have early on in the process with someone who might be coming in for knee replacement or shoulder replacement? That's a conversation you try to hash out early on, or is that in the middle? Where might you have that talk?
Well, that talk comes when it starts to become evident that our non-operative treatment has not been sufficient, and they're thinking about surgery as an option. Then if they meet kind of the medical criteria and they're interested in an outpatient surgery, then we explore that. And these days, that can be possible not only for knee and shoulder replacement, as you mentioned, but we're also doing hip replacement as an outpatient now in properly selected people.
You kind of touched on where I wanted to go next, but how do you know? I guess the doctor will tell you, but how do you know when it's time to strongly consider a joint replacement surgery?
Actually, the patient will pretty much tell us, because the things that we're doing, if in terms of non-operative treatment, whether it be physical therapy, injections or medications and braces and all those kind of things that can often be very helpful, when they stop allowing the patient to function at their desired activity level and start to impede their general health by limiting their activity and maybe their sleep, then the patient will pretty much tell you, look, doc, this is it. We have to do something about this. And that's when the next conversation happens.
A common thread, whether I'm talking to you or some of our other guests, it comes down to a quality of life issue or subject, doesn't it? If your quality of life is being impacted, then it's time to consider an alternative to what you've been doing, right?
100% right. Your quality of life and the quality of your health.
We're talking about same-day joint replacement. Dr. William Post, Mountaineer orthopedic specialist. Stacy Ferguson, Mon Health Outpatient Surgery Center. They are our guests this morning. You still there, Stacy? Because you're coming up on the other side of this break, okay?
Okay.
All right, we'll jump into that with Stacy. We'll talk about the facility. We'll talk about joint camp. I don't know if that's the summer camp. We'll find out. We'll do that on the other side of the break. You're listening to Mon Health Talk right here on the voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our Mon Health guests, call now 304-296-0041.
Dr. William Post, Mountaineer orthopedic specialist. Stacy Ferguson, Mon Health Outpatient Surgery Center, our guest this morning on Mon Health Talk. Stacy, explain to me, what is an ASC?
Dave, an ASC is an ambulatory surgical center. It's basically a facility that specializes only in outpatient surgery. We do nothing else besides outpatient procedures. So it enables us to really focus in on our patients and repeating the same thing over and over again and perfecting it.
And that's what you do, obviously, at Mon Health Outpatient Surgery Center, right?
Yes, sir.
So what is joint camp? Is this some summer camp for orthopedists that I don't know about, or what is joint camp?
Yeah, joint camp is our new program for our outpatient total joint procedures. And what it does, we bring patients that are either scheduled or contemplating an outpatient total joint procedure together at a scheduled time, and we explain to them the procedure, how to prepare for the procedure, how to prepare their home to be nutritionally optimized for the procedure, and to develop expectations and goals and guidelines for them for their post-op recovery. They meet with a physical therapist, they meet with our anesthesiologist, they meet with some of the healthcare team that'll be caring for them the day of surgery. They get to see the facility, and we get to make that great connection with our patients so that they realize that all of our care is customized to each individual.
You know, that sounds like a great service, because I think a lot of people go, okay, the surgery, I'm in, I'm out, I'm back home, but giving thought to how to arrange their home, there's obviously going to be physical therapy afterward as well, which I don't think a lot of people think about when they go in. So it sounds like kind of a comprehensive overview for the patient who's getting ready to, go through this joint replacement surgery.
Yeah, it really is. And it's been very well received by the patients. The statements that we're getting back in our surveys are just their glowing reports on how they did feel prepared, how they weren't anxious. It's all about getting the patient in the right mindset, getting them physically prepared for the procedure, mentally prepared for the procedure, and for their recovery. We also give them resources, so when they go home, they're not alone. They can contact us, they can contact their surgeon, they can contact their therapists. So we're just, bridging that gap for them so they can go home, not stay in a hospital 3 days, and have as good an outcome as they did if they had stayed in the hospital.
Not only are you offering, the obviously to get the surgery done and the physical benefits of that, but surgery can be scary for anybody. On anything, they always say it's a minor surgery unless you're the one getting the surgery. So offering that mental peace of mind going in and coming out of it is a huge benefit that, again, a lot of people probably don't give a lot of thought to until it's time to get a knee or hip or shoulder replaced.
You're exactly right.
Hey, guys, anything new from joint perspective? We got about 2 minutes here. Anything new to let us know about? Maybe we'll talk about on a later show.
I think, there's quite a few new things in the world of orthopedics, and we're making advances all the time with both the design of implants for knees and shoulders and hips, and also the methods of putting them in. And what we're talking about in those situations sometimes make huge differences, and sometimes they're incremental improvements, but they're all designed, with the patient in mind. And it's been pretty exciting over my career to see those things go consistently forward.
Tell you what, I'm going to jot that down. We'll have you back someday. We'll talk about some of the new advancements because, like with a lot of things we talk about on this show, it's not your dad's or your mother's procedure anymore. There's so much advancement that's been made in such a short amount of time. Guys, if somebody is thinking that joint replacement is something they need or they want more information about the Outpatient Surgery Center, Dr. Post, can folks get a hold of you directly? Do they need a referral? How can they get in touch?
We do not require a referral, Dave, to come to our office. They simply need to contact our office. We're in Cheat Lake, and both of us can be reached through the Mon Health website, which is monhealth.com/ortho, or you can reach out directly to our practice.
And Stacy, how can folks get in touch with Mon Health Outpatient Surgery Center?
Our website is monasc.com. They can get in touch with us there or through our phone number, 304-413-2200.
Well, guys, I thank you so much for taking a few minutes with me here on a Monday morning to discuss this. Hey, have a great holiday season. Stay well. And look forward, I tell this to the guests every week, I look forward to one day actually getting you back in the studio with us. That will happen one day. I believe it.
All right, Dave. Keep believing.
Thank you.
Guys, thank you so much for your time this morning. Hey, coming up, we got Fox News, local news, and it's the main segment of the Talk of the Town. Straight ahead, right here on the Voice of Morgantown, WAJR. Pause for edit, and you nailed it.